Medicare open enrollment wraps up next week. It's a critical period for seniors when it comes to their health care. Here with vital information, Dr. Linda Johnson, Senior Medical Director of Primary Care. How are you?
I'm terrific. Good to see you again.
Great to see you as well. For people who are not familiar, what exactly is open enrollment and why is it so important?
So open enrollment's been going on since October 15th, and it goes through Monday, December 7th, so we're nearing the end of it. And it's the time of year that people who have Medicare or a Medicare Advantage plan can change if they want to or if they need to. It's changing not only their insurance plan, but also choosing their primary care doctor if they haven't or if they need to change one. So that's why I'm here, because Southwest Medical Associates, we're proud to associate with with straight original Medicare, as well as with senior dimensions.
Oh, go ahead.
No, I was going to say, so if someone's already with us or with senior dimensions, they don't have to do a thing. They can just stay put. They don't have to change any enrollment. But if there's something going on with their health or they're looking for something different and they want to be with us, then now's the time to change. They've got till Monday.
And if they don't do it, that means they're going to be locked in for another entire year before they can make changes. Right. So if they want that senior dimensions program, like the doctors at your group, now would be the time to make that switch.
Exactly. They make it by December 7th.
Is the deadline at 9 o'clock, midnight?
I believe it goes through midnight.
Through midnight. And you know, sometimes the computers fail, so
Right.
don't wait till the last
minute
because that's happened to me with different things. But now, for people who do want to make the change, you go online and do that, or do you fill out the paperwork and make sure it's stamped?
So there's a variety of ways to do it. There's a phone number on the screen that they can call, and the folks on the end of that line will help walk them through it. There's online resources if they're savvy in that way through Medicare.gov. But probably the most personal touch is if they call the phone number that's on the screen.
And what do you want to tell people who are just turning 65, don't know about this whole process, and we're getting to the deadline here?
Well, when you're just turning 65, it's a little bit different. When you're retiring, we call it aging in. You're becoming eligible for Medicare. That can happen around your birth date or your retirement age. So that doesn't necessarily get you locked into this December 7th date. So that happens all throughout the year, depending on your birthday and when you're retiring. But it's the same type of things that are available to you. So if you choose to have a Medicare Advantage plan and even just original Medicare, not every place takes that. So it's the time to look into what your health needs and see what's the right fit for you that's going to give you the kind of care that you need.
So if you're turning 65 and you're just aging in, as you said, you have a little bit of more time or flexibility than someone who is going to meet that deadline on Monday.
Exactly.
And for people who are not familiar with this whole process, does it take a while to go through the paperwork and get the information that they need?
Well, I think probably the biggest amount of time is just exploring the different plans. And so if you're just now starting, you really need to get in gear. But you can go to Medicare.gov, and it shows all the types of Medicare plans that are available in your area, because it's different from state to state. So that would show the ones that are specific for our area here, specifically even Southern Nevada. And you can compare what your prescription needs are and what your diagnoses are, what plan might be the best for you. And based on that, then, you can sign up for which plan works out for you. But that can be a little intimidating for some people. And quite honestly, poor seniors have been getting their mailboxes bombarded since October with all these different plans. So again, a more personal touch is calling the number that's on the screen, and that's someone that can answer those questions and make that not so confusing and scary and help walk you through it. And with that person's help, it actually doesn't take a long time. So.
And how many people are in your group, medical professionals?
Well, we're growing. We're over 22 locations now, and we've added almost 100 providers this past year. So we're over 330 providers in the Southern Nevada area here in Clark County.
So for people who are moving into town and are looking for a new doctor, your group basically has an office everywhere.
We've got an office everywhere.
Reach.
And I actually, before I came here this morning, I took a kind of sneak peek tour of our newest location, which is being built at Okie and Decatur.
Oh, congratulations.
So it's a big 100,000 square foot building. So we're really excited that will open up in March.
In March. You'll take patients in March. That's wonderful. And for people who want to go and see a doctor and enroll in that plan, if you are already enrolled, once again, you don't have to
do anything. If you're enrolled in the plan you like, and if you're with a Southwest doctor you like, then you don't have to change anything. But if you want to switch over and have Southwest Medical Associate providers, your physician, then now's the time to do it by December 7th.
And very quickly, since you are a doctor, people are getting sick right now. Any words of advice for people who are going through a cold or the flu?
Well, first of all, if they haven't gotten their flu shot, they need to get their flu shot. Everybody should have it. But it's rest, stay home, lots of fluids.
So that's what the doctor ordered. Stay home if you're sick. Thank you so much.
Oh, my pleasure.
The countdown is on to make changes to your Medicare plan. Open enrollment runs through Monday, December 7th. Southwest Medical has locations across the valley. To learn more, call the number or check out the website right there on your screen. Also, check them out on Facebook and Twitter.